Hi, I'm Dr. Molly with Your Goals Physical Therapy. Did you know that there are 500,000 back surgeries done every year? Isn't that a crazy number? And the sad thing is that there isn't like one thing that always leads to that. So what I mean by that is some people have really persistent and very severe, just localized back pain. Some people that have back surgery have numbness and tingling going down one leg. Some people don't have either one of those. They just all of a sudden start having some muscle strength loss on one side or the other. And then the unfortunate few have all three of those. So they end up with severe back pain, numbness and tingling going down one leg, and then the loss of strength to go with that. So back surgeries are around for a very, very good reason. In fact, I know many people who have had wonderfully successful back surgeries, where their surgeons have prepared them and they've talked to them about how you're going to need to rest for a certain amount of time. Then you're going to slowly start adding exercises. You're going to see a physical therapist so that you kind of learn how to move and reincorporate how to move through your environment correctly. And then, of course, it's a slow, steady progress for 6 months to a year after you have back surgery. And that's when you get the best results. But unfortunately, with as many good ones as I see probably twice as many kind of either 50-50, gains from the surgery to some bad results. Just like my new friend George. So George is a 45-year-old man who is super sweet. He has a loving family and he was a limo driver. He just loves that too. You get to be a part of everybody's life. You get to be at all the major events. You get to meet famous people and, political people and, all walks of life, right? Anything from high school graduations to birthday parties, everything, right? It's a very exciting, if you're a big people person, to be able to drive a limo. And he did this for over a decade. This is how he supported his family. So this was a huge sense of pride for him because he was able to take care of his family and feel like he was good at this. And so he was not going to give that up for a little bit of back pain for nothing, right? So he just muscled through that, right? It's just a little backache. And that went on for years until it wasn't just a backache. Then it started to affect other parts of his life, right? And so it finally got so bad and it was just so persistent that he went and he found an orthopedic surgeon and he was talking to the surgeon and the surgeon said, all right, so we're going to set you up for an x-ray. We're going to set you up for MRI. In the meantime, I'm going to give you these painkillers and I want you to kind of rest and try these exercises. And he gave him a sheet of paper with some exercises, which George tried to do under the best of his ability. He took the pain medication as he was supposed to. And then he went in for his x-ray, and he went in for his MRI, and he waited for those reports. And then the pain wasn't going away. The painkillers took the edge off, but didn't really help, for long standing. And the exercises didn't seem to do a darn thing for him. And so he stopped doing the exercises because it was kind of a waste of time. And he had to go back, to find out what the results for the MRI. The MRI showed that he had a herniated disc. But the surgeon said, we're still going to wait and see what happens. Well, after a month or two, George was like, the pain didn't go away. And in fact, it got worse. I wasn't able to sleep. Everything was kind of progressing. It was like snowballing. So the surgeons scheduled an injection. So he went in for the injection and it helped for like a couple weeks, but not really anything, right? I mean, and injections kind of can help immediately or take a while, and he waited and nothing was happening. So George is like steady, just getting frustrated and just feeling like his back is ruling everything. You can't brush your teeth, you can't sleep, you can't roll around in bed. There's everything hurts when your back hurts. You can't sit, you can't stand for long, can't go to the grocery store. He was having to cut shifts. And so when the surgeon told him that the only other option at this point, because his pain was so severe and the limitation was so great, he had to go in for surgery. So George was like, it was a no-brainer. I can't work, I can't sleep, I have to be a good husband. I'm snapping up my family. I don't have any patience. So now all because of this back pain. I'm not a good husband, and I can't stop myself. I'm just so frustrated all the time that any little thing sets me off. And I just need this to be over. I need it to be done, right? I'm over this back pain. And so he goes in for the surgery. He wakes up from the surgery and he's like, I have no pain. And then somebody gets him up to go for a walk, and he has no control of his ankle. His right ankle, the one you need to drive, does not work. Every time his heel hits the floor, his foot flops. So he has no control. He lifts up his knee. He has to lift it up super high so he doesn't trip over his own toes. He just has no control. Can't lift his ankle up at all. So of course he's asking, and they're like, well, it could just be a side effect of the surgery. It could come back. It could take a while. It could never come back. We don't really know. And so, so there's George, no pain now, but his right ankle doesn't work. And so when I met George, he was about 2 months out. He'd already tried the therapy that they do after, being out of the hospital, the therapy in the hospital, and he still really just didn't have any control over his ankle. I'm an eternal optimist. We have made progress. We are getting a little bit stronger, but we're still out to see what will happen in terms of him having enough control to be able to get back to driving. And that is one of the sad things that I'm seeing. I see that people wait until the back pain or that little bit of an ache that you had now rules everything. So what started as being a little sore if you watched a movie for too long ends up being something that you can't sleep anymore. And so at that point you have no more options, because what do you do when you can't sleep and you can't be a functioning, nice human being in your life? You have to fix that. And so my plea for everybody is that it is so much easier when you deal with back pain when it is just an annoying ache that maybe is persistent, maybe it's kind of a reoccurring thing. There is something that causes that to come back. And that something, if left just to do what it wants to do, can become so bad that you don't see any other options other than surgery. So I have a book that I put together that is 7 tips and tricks on how to keep your back from going out more than you do. And it's a simple way to start if you're just looking for a couple answers. If you've kind of researched this and you want just more specialized information about what's going on for you, feel free to direct message me. And I will do my best to answer all of your questions, because I truly believe it is easier to deal with back pain when it's an annoying ache than it is when it's devastating, persistent pain. That's not to say that there aren't options, and that I have treated people with some very severe back pain to get them 100% back together, but most people don't feel that way. You feel like your only option is surgery, and I want to give you a little voice of hope that says that even in severe pain, you have options, but it is so much easier to believe that and to move forward with this when it's just an annoying ache. So I hope you're having a great day, and I hope you're not dealing with back pain. You have a great afternoon. Bye.